Many brands of birth control pills have been sold in the U.S. since 1960, but only by prescription. But now, thanks to a unanimous decision by the Food and Drug Administration, one version called O-Pill will be available over the counter early next year.
I voted yes, and I voted yes because the evidence demonstrates that the benefits clearly exceed the risks.
Federal regulators say they hope O-Pill's availability will prevent some of the nearly 3 million unintended pregnancies in the U.S. every year. If taken as directed, O-Pill prevents pregnancy 93% of the time, a much higher rate than condoms, spermicides, or other non-prescription methods. The only people who shouldn't take O-Pill are those with a history of breast cancer. The major benefit, say reproductive health advocates, is greater access to contraception that works.
Many of the barriers that prevent people from accessing contraception right now, the barriers that come with the prescription requirement, like having to see a doctor, getting off time from work, getting off time from school, finding childcare, the cost of the visit, all of those things. This access to a pill directly over the counter will mean that people can have vastly different access to a highly effective birth control method.
The pills maker hasn't announced O-Pill's price yet, and healthcare workers say that's a concern, especially for low-income consumers.
We are looking for insurance coverage. Our goal is that this is fully covered by insurance, and so there are several next steps around that, and really do hope policymakers really are able to make that a reality in the United States.
O-Pill's approval means the U.S. joins dozens of other countries that sell oral contraceptives over the counter, giving more people control over when or if they decide to become pregnant. Rosiland, Al Jazeera, Washington.